Returning to our top story, COVID-19 hitting the provinces hard. Hospitals, they're overwhelmed by the volume of patients. All these as the country grapples with limited vaccine supply. We now go above and beyond the headlines with Health Undersecretary and spokesperson Maria Rosario Vergeire. Good evening, ma'am, and welcome to Newsnight. So let's begin with this idea, no, this parang plan of action. I-regulate na po ang buying of oxygen tanks, stockpiling oxygen tanks in Cebu. Is this something that can be considered for the entire country? Because we know this is happening in many other parts of the country, especially in urban areas, ma'am.
Yes, ma'am. No? So this is one of the things that is being discussed right now by our officials. So we have existing policies regarding this matter. For example, we have the RA 3720, which is the FDA law, which is now the RA 9711, wherein it states that all medical products, including oxygen, should be regulated. And also we have FDA circulars, which will be able to enforce this kind of regulation among these suppliers of oxygen.
Okay, so in other words, ma'am, meron naman pong, like you're saying, no, may batas naman po. Ang kailangan lang gawin ng tao is sumunod. We've all heard this before. Ignorance of the law excuses no one. Just because you're ignorant of the law doesn't mean that you won't follow it. So, ma'am, what you're saying is that this is something that the DOH will announce and say na nationwide na ito, walang pwedeng mag-stockpile ng oxygen tank.
Tama po yan, no, ma'am. So we are now discussing with the Department of Trade and Industry and also with the DILG so that we can be able to form these composite teams that we can be able to enforce in the different areas of the country. Monitoring and enforcement would be very critical so that we can better implement. We would also be announcing to the public that they cannot procure or buy this oxygen supply without a prescription, because according to the law and according to the policy, this oxygen, the medical oxygen, should have a prescription before you can buy it.
Mm-hmm. At ma'am, hindi po dahilan para mag-stockpile ng oxygen tank yung sabihin nila, nagpe-prepare lang kami just in case, gano'n. Hindi po dahilan yon.
Hindi po. And then also, we'd like to warn households who are buying oxygen tanks and storing it in their houses. Ano po yan? That's very risky. It is flammable at konting parang trigger lang po dyan ay maaring sumabog yan dyan sa inyong kabahayan. Kaya po talagang maingat dapat ang paggamit nito. Pangalawa, this is a medical product. So it should be that when they use that, it is guided by their physicians. Hindi po basta pwedeng bumili tayo and then you can use it on your own. Kailangan pa rin po ng guidance ng mga healthcare worker when you use that.
Pero madaling i-check din, ma'am, kung sino yung mga bumibili. Kasi i-check lang po natin sa mga suppliers, di ba? Sino yung madalas bumili at kung bumili sangkaterbang oxygen tank. Anyway, ma'am, pag-usapan lang po natin itong vaccinating children. Meron na pong statement yung pediatricians and ID experts about how it is not something that we should do right now, that also the best way to protect children is to vaccinate the adults, to maximize yung adult vaccination. Is that correct? Is that where we are headed for now, ma'am, for the meantime?
Yes, ma'am. Actually, last night we had a meeting with our all experts group on vaccines, and this includes almost 100 experts that we have. We had this discussion, and what we are trying to point out right now would be the issues on safety, the issue on equity, and of course the issue on prevention. On the issue on safety, because we all know that right now only Pfizer has that EUA for these kids below 18, the 12 to 17 years old. And for Pfizer, it is specifically included in their EUA and in their labels that there is this possibility for this myocarditis among the younger age group. So that's one. So we would like to have more evidence on this, that our kids will be safe when we give this vaccine. Second, it is really the equity issue. This is the major part, because we all know that based from our data and analysis, the increase in the number of cases right now is across all age groups. It's just that some groups are trying to hide the children are more affected than the rest. So we just like to inform the public that it is across all age groups, and we can still see the same trends as before, that the most vulnerable will be this adult population. That's why the recommendations of our experts would be that we would be wait for that time that we have sufficient evidence for the safety of these vaccines among our children, and also that we will wait until our supply stabilizes.
Mhm. Well, ma'am, siguro ang magandang gawin din ng DOH at ng, well, lahat ng news outlets, kasi isa po ito sa ginagamit namin, itong i-release na po natin ng buo at i-support ang statement ng Pediatricians Association para mabasa, kasi it has a very calming effect sa mga magulang. Ma'am, itong issue ng high risk na ang Philippines at the moment, in like one or two sentences, if it's possible, ma'am, how did we get to this point na high risk na po ang classification natin?
Katulad ng lagi po namin sinasabi, the factors right now for these increasing cases, major ones would be the variants of concern. And we all know how transmissible these variants are, specifically the Delta variant. Delta variant case can infect at the most 8 individuals in just one interaction. So that is why we are looking at exponential increase in the number of cases. Mabilis po. In just about 3 weeks, we saw this rise in our rates for the different cases. We now have 41 flagged areas in the country where there are rising cases, and also their healthcare utilization is at critical risk already.
Mm-hmm. I wanted to ask you also, ma'am, and again, very briefly lang po, no, so many hospitals in the regions and in the provinces are appealing for help. Earlier in the newscast, we had this report about Cagayan province, and we see this replicated in so many other provinces, and we're going to see this in the next few weeks. Apart, ma'am, from increasing the number of health workers, increasing support and help, what else can we do? What else can the government do, and what else can we, people, do?
What would be most important right now, aside from preparing our healthcare system and, as you said, expanding our beds, healthcare workers augmentation, what would be most important is to cut the transmission in the community. And we can only do that by limiting mobility of people, by early detection, that we will go house to house and look for those cases or individuals who have symptoms and easily isolate them. Also, we need to shorten the time when we detect to when we isolate. So meaning we need to have within 24 hours all of those who are having symptoms or who had been exposed, we need to isolate and quarantine them. So that's one. Number two would be for us individuals, we need to help government. We need to comply with the safety protocols. We need to continue on doing the minimum public health standards so that we can be protected. And number three, and most importantly, let's have ourselves vaccinated, because this is one of the tools that will help us to have this population protection, and therefore we will see less cases and less deaths.
Oh, maraming naman talagang gusto magpabakuna, ma'am. Ang problema lang talaga siguro supply. But anyway, and my final question, ma'am, no, on social media kasi, and this was before this ECQ, before this lockdown, we see a lot of people posting how they get together with their family and friends, balay mga hindi nila kasama sa household, no? And then they always say, palagi nasa caption yan, don't worry, we are fully vaccinated. At this point in time, ma'am, what is the best course of action? Should that kind of behavior continue? Should people still be getting together kung hindi nila ka-household and then say, vaccinated na naman ako?
Yes, I'd just like to remind the public, there was this recent publication wherein it's showed for those vaccinated and for those unvaccinated, especially for the Delta variant, meron po tayong pinakita doon sa publication na halos pareho lang po ang viral load. Meaning, even if you are vaccinated with this Delta variant, you can still infect other people and you can still get infected. What I'm trying to drive at would be, at the outset, when we had the vaccines, we have advised people that these vaccines may not be able to block transmission because you can still get infected and you can still infect others, but This will save us from severe infections, hospitalizations, and deaths. And right now, we are seeing this, that those who are vaccinated are having mild symptoms. Those who are unvaccinated are the ones, most of them are the ones in the hospitals. So now may I just inform the public that even if you are fully vaccinated, you still need to follow safety protocols because you can still get infected and you can still infect others. And the sad part of that would be if you infect an unvaccinated person, they would maybe end up in the hospital, unlike you who is vaccinated.
Oh, so ma'am, if they say na they're gathering in groups of 10, meron silang birthday celebration, 10 sila, sabihin nila, lahat naman tayo bakunado, okay lang po?
No, that is not okay. And we are advising people to maintain your family bubble. So if you live in one house, that is okay. You have that every day. But if you are going to invite somebody else coming from another bubble, you have to think twice right now because we know that the spread of these variants of concern is increasing. And we know that even if you are fully vaccinated, you can still get infected.
Oh, yan. Paulit-ulit na sinasabi ng DOH, parang sirang plaka eh. Maintain your family and household bubble. Maria Rosario Vergeire, spokesperson of the Health Department. Ma'am, thank you very much again for joining us this evening. Still ahead on